pregnancy is a 9-month marathon for your body, but for one tiny organ, it's an absolute sprint right from the starting line. Within just a few weeks of conception, your thyroid gland starts growing, and your body's need for thyroid hormone skyrockets by up to 50%. So, what's really going on with your thyroid, and what does it mean for you and your baby? Introduction: Your thyroid is that small, butterfly-shaped gland in your neck, and it's basically the engine room for your metabolism. During pregnancy, it kicks into overdrive, adapting in some truly surprising ways to support both you and your developing baby. These changes are totally normal and vital for a healthy pregnancy, but they also explain why thyroid issues are so common during this time. Let's break down what's happening trimester by trimester. Section 1. The first trimester, the hormonal ignition right from the get-go. Two key hormones surge, estrogen and human chorionic gonadotropin, or HCG. Yep, HCG is the very same hormone that your pregnancy test is looking for. Because HCG is a bit of a lookalike for thyroid-stimulating hormone, TSH, it gives your thyroid a little nudge, telling it to produce more hormones. This hormonal push is so effective that it actually causes your natural TSH levels to drop, which is completely normal. Here's why that's so important. For the first 18 to 20 weeks, your baby is entirely dependent on your thyroid hormone to develop their brain and nervous system. This makes your healthy, functioning thyroid absolutely critical from day one. To keep up, your thyroid gland itself starts to change, growing by about 10 to 15% and becoming more vascular to handle the extra workload. Section 2. Second and AMP. Third trimester is the new normal. As you roll into the second trimester, your body keeps adapting. Higher estrogen levels ramp up production of a protein called thyroid binding globulin, or TBG. Think of TBG as the bus service for your thyroid hormone, shuttling it through your blood. With more buses on the road, your total thyroid hormone levels rise, but the amount of free, or active hormone that your body can actually use stays about the same. This is exactly why doctors use different, trimester-specific TSH reference ranges during pregnancy. A TSH level that looks perfectly fine for someone who isn't pregnant might signal a problem when you are. Generally, the target TSH level during the first trimester is below 2.5, and it's below 3.0 for the rest of the pregnancy. The demand for thyroid hormone really peaks around 16 to 20 weeks and stays high right up until delivery. Section 3. What this means for you and your baby. Because of all these dramatic shifts, pregnancy can sometimes unmask or even worsen thyroid conditions. Hypothyroidism, or an underactive thyroid, affects about 2 to 3% of pregnant women. If it isn't managed properly, it can lead to complications. This is why staying on top of it is so important. For women already on medication like levothyroxine for a known thyroid condition, guidelines recommend increasing the dose by about 20 to 30% as soon as the pregnancy is confirmed, which often just means taking 2 extra tablets a week. Throughout the first half of pregnancy, your doctor will likely check your thyroid levels every 4 to 6 weeks to make sure the dose is just right. Hypothyroidism, or an overactive thyroid, is less common, showing up in about 0.1 to 0.4% of pregnancies. It's often caused by an autoimmune condition called Graves' disease. Treatment is crucial here, too, and usually involves anti-thyroid medications. Propylthiouracil, or PTU, is often the go-to choice during the first trimester. CTA. Whether you have a known thyroid condition or not, the single best thing you can do is keep an open conversation going with your healthcare provider. If you have a family history of thyroid issues, another autoimmune disease like type 1 diabetes, or you've had thyroid problems in the past, make sure you bring up screening with your doctor early in your pregnancy. Conclusion: the incredible things your thyroid does during pregnancy are a masterclass in how your body prioritizes your baby's development. From literally growing in size to boosting hormone production by 50%, it works tirelessly behind the scenes. After delivery, the demand drops, and women on thyroid medication will typically need to reduce their dose back to pre-pregnancy levels. However, some women might develop postpartum thyroiditis, an inflammation of the thyroid that can pop up within a year after birth, causing swings between an overactive and underactive thyroid. So if you're feeling unusually tired, anxious, or notice big mood changes after delivery, it's definitely worth checking in with your doctor. With a little awareness and great medical care, you can navigate these changes with confidence, ensuring a healthy journey for both of you.